Bismillahirrahmanirrahim. Uh, Question number 50. A 75-year-old man has experienced a gradual decline in memory and self-care skills over the past 6 months. He also suffered from urge incontinence and he's on enalapril and hydrochlorothiazide for hypertension. He has a mini mental state of examination score that is 18 by 30. He is disoriented in time and place, has a poor short-term memory, mild dysphagia, and impaired arithmetic, planning, and visuospatial skills. Blood test shows sodium 129, which is low, and potassium is a 3.8, that's normal. Creatinine 0.19, which is high. Hemoglobin is 9.8 with a normocytic normochromic blood film. Which one of the following is the most likely cause for his clinical deterioration? The options are normal aging process, carcinoma of the prostate, hyponatremia, chronic renal failure, Alzheimer, dementia. In this clinical scenario, which is a progressive onset of dementia in an elderly man with hypertension, the most likely diagnosis is Alzheimer dementia. Although multi-infarct vascular dementia, not an option in response, is also a possibility, but is still less likely than Alzheimer's disease. So, Alzheimer dementia is a correct answer. There are other options in which normal aging can be associated with increased frailty and some deterioration in faculties of sight and hearing, and even some mild forgetfulness, but the mini mental state of examination score should be more than 26. This patient has urge incontinence and renal impairment, which may well be related to prostate hypertrophy or carcinoma of the prostate. However, the deterioration in multiple higher center function is unlikely to be due to cerebral metastasis in the absence of any other focal neurological symptoms or signs. Hyponatremia in this patient is a mild and most likely due to the syndrome of inappropriate ADH secretion, is a common adverse reaction to the thiazide diuretics. This condition is usually asymptomatic until the sodium level falls below 125 and also depends on the rate of change in the sodium level. It can present as a mild confusional state, lassitude, and sleepiness progression to gross confusion. The patient has a significant renal impairment and a normocytic normochromic anemia, which are consistent with the chronic renal failure. This condition is usually asymptomatic until the GFR falls below 15 ml per minute, and patient present with vague ill health, lack of energy, weakness, GI symptoms, and pruritus. The neurological manifestation of chronic renal failure occur very late in the course of the disease with peripheral neuropathy and myopathy. With severe uremia, there may be a muscle twitching, drowsiness, fits, and coma. So the Alzheimer dementia is the correct answer. A 12-year-old girl whose first period started 2 weeks ago presents because of very heavy bleeding, necessitating her to use 10 sanitary pads per day, and the bleeding does not seem to be decreasing. Which one of the following investigation is most likely to define the cause of this problem? 12-year young girl, first periods started 2 weeks ago, presence because of heavy bleeding. Bleeding does not seems to be decreasing. Which one of the following investigations is most likely to define the cause of this problem? Hemoglobin level, bleeding coagulation profile, serum ferritin, dilatation and curettage, MRI of the pituitary gland. With heavy prolonged bleeding at the time of the menarche is common. The severity of bleeding and its effects on the hemoglobin level needs to be assessed by hemoglobin and ferritin levels. These assessments, response A and C respectively, do not define the cause of the problem, but do define its effects. Approximately one-third of girls with pubertal menorrhagia have a hematologic causes such as thrombocytopenia, acute leukemia, or a coagulation bleeding disorder. vein brain disease. To rule out these diagnoses, a full blood examination and a bleeding clotting profile needs to be performed. So option B is correct, bleeding and clotting profile. Performance of hemoglobin estimation or assessment of ferritin level are clearly not sufficient, and the performance of dilatation and curettage or MRI will not usually define the cause of the bleeding. So in this case, first we will go with this bleeding and coagulation profile. So option B is correct.